We were in a mental health crisis before COVID. There was some awareness of that. One of the things that we know contributes to depression and especially self-harm and suicidality is loneliness. So it's not surprising to me that when we disconnected from each other and were at home and not able to have as many in-person interactions, and we didn't have, our activities that we could go to, that we saw a worsening of kids' mental health. And I think the other thing to think about too, and why, maybe why we're seeing our current crisis is an important part of childhood development is play. And there's only so much play you can do through a screen. A lot of play has to be done in person, even for adolescents, right? As serious as they may seem sometimes, they also play and they need to be able to interact with each other in a playful way. The thing about social media is that it is designed to feed you where you're at, and somehow it always seems to know if you're having image concerns, you may be more likely to be fed information that can challenge that positive self-image. If an adolescent's in a negative headspace that, I'm not as good as others, or I'm not as successful as others, or I don't look as good as others, then when they see images through media, they're going to bring that bias towards viewing those pictures, right? And so they're going to use it to compare themselves in not a good way. Whereas if they're a kid with a pretty solid self-esteem, right, they're going to be more capable of kind of consuming media for what it's worth. And I think sometimes, one of the things we forget too is that really social media is a curated story that people put out there, and it's not a representation of reality. And so I think teaching our kids how to consume any kind of media critically, starting in elementary school, is going to lay an important foundation for being able to consume social media in the future. I think the first thing the parent should do is to thank the child for trusting them with that information and to acknowledge how difficult it was to come to the parent with that. The thing I always tell my patients when they tell me about a friend who's having thoughts like that is you would rather have a mad friend than a dead friend. We can deal with a mad friend. It's a lot harder to deal with a dead friend. So, we need to take the next step and make sure that this kid is safe. A lot of schools have crisis tip lines that can be called, and there are people monitoring those lines and who can follow up with them, right? Ideally, you would make a call to the peer's parent, would be the next step to make sure that the child was safe. And honestly, if that peer's parent is not receptive and their address, I would go as far as to call emergency services to go out there. Again, I'd rather have people mad at me than have somebody dead. Everybody is struggling with mental health. I think that's maybe one of the big things families are struggling with. And I think, there really is a bit of just collective trauma from what we've been through, and figuring out how to heal from that trauma together when more stressors are being thrown at us by, other people's behaviors or kids' behaviors and stuff like that is going to be a challenge moving forward.